This is Group 6's project containing Trinity, Dakota, Danny, and Adaria. Our problem is how can we decrease the number of annual healthcare associated infections?
Hello, my name is Dakota Gray. I will be speaking about how we can help solve healthcare associated infections, starting off with the use of protective wear, using gloves and full body protective coveralls, and wearing masks. Another solution would be having protective measures such as having checkups, washing hands, and keeping away from the sick. Results of these measures being taken would minimize morbidity, which is the disease in a population, reduce healthcare costs, and save lives and reduce deaths.
Now, if we look up at the top left corner, we'll see a graph that shows 6 healthcare associated infections according to their numbers of cases per year on the x-axis and the number of deaths per year on the y-axis, with the disability adjusted life year per year as the width of the bubble. So if we look at pneumonia, for example, that's one of the biggest bubbles on the screen, meaning that people are severely affected by this healthcare associated infection that they previously did not have.
So item one fact is an estimated number of 2,609,911 new cases of HAI happen every year in the European Union. And then I got another fact. Item two fact is HA, UTI, SSI, HA, CD, and HA primary BSI ranked as the third to sixth syndromes in terms of burden of disease. Item three facts. The U.S. Center of Disease Control and Prevention identifies that nearly 1.7 nearly hospitalized patients annually acquire HCAIs while being treated for other health issues, and that more than 98,000 patients died due to these.
Portion of the project was the background information from credible sources. So number 4, common types of HAIs are catheter-associated urinary tract infections and surgical site infections. So a catheter is something that is used during surgery, and then the surgical site is anywhere where you're cut. Number 5, preventative measures estimate to be about 25 billion. So that's for like PPE, anything that's like gloves, body covers, or hairnets. Number 6, studies show proper education and training of healthcare workers can prevent. So if hospitals make their workers do little procedures or anything that can ensure that they know the proper way to wash their hands or the proper way to use the PPE and replace it, that can prevent it. Number 7, about 1 in 31 hospital patients received an HAI. Number 8, healthcare procedures leave you vulnerable to germs and diseases. So any procedure you have done in the hospital, whether it's a surgery, major or minor, you're vulnerable for germs and diseases. Number 9, studies show that implementing preventative methods in hospitals can reduce it up to 70%. So just doing any little thing, whether it's a hand washing or a method to prevent it, it can be up to 70%, which is a lot because, like we mentioned earlier, in Eastern Europe it's 2 billion. So imagine reducing that by 70%. And then number 10 is devices used in surgery can lead to HAIs. So a common device, like I mentioned earlier, is the catheter. I know that is used a lot, and research says that one is the number 1 in all hospitals. That's the main one that people get infections with.
If our solutions were used, the first way it would impact the future would cause a limitation on the infections that we come in contact as individuals due to having protective personal equipment. The second way it would impact the future is simply fewer people get sick, which means fewer unnecessary deaths in the country because of the simple tactics implemented, such as washing hands and just simple things such as staying away from those who are sick.
How this topic relates to our careers? Well, our degree and career interests. Well, Dakota is a nursing degree major and wants to become a registered nurse. Danny is a nursing degree major and wants to become a CNA. Adaria is a public health degree major, and I'm a Bachelor's of Science in Nursing and Multidisciplinary Degree Studies major. So this topic relates to our careers because as future healthcare professionals, it is vital to be informed about the risks associated with acquiring healthcare-associated infections while treating patients hospitalized for unrelated comorbidities, because it is part of a nurse's jobs to monitor and report on the status of a patient's care. And then if you look on the bottom right, you'll see your APA references for our peer-reviewed credible sources. And these are different ways we can help solve and reduce healthcare-associated infections. Thank you for watching.